Have you ever felt your feet turn cold for no reason or noticed your legs growing heavy after walking only a short distance? Have you ever experienced a strange little tingle in your fingers after sitting still, almost like your blood needed a moment to catch up? A patient of mine once shared that she felt these tiny changes for years and always blamed them on getting older. She never imagined those quiet sensations were early whispers of poor circulation building long before her heart began to struggle. I want you to imagine this with me. Picture your heart working faithfully every single day, sending blood to every corner of your body. Now imagine that blood moving just a little slower than it should. Not enough to cause pain, not enough to alarm you, but enough to create moments that feel off. A cold toe here, a little dizziness there, a heaviness in the calves that you ignore because it fades quickly. These are often the earliest heart attack warning signs, yet they rarely look like danger at first glance. The truth is that poor circulation is one of the most overlooked early indicators that the heart is under stress. It is rarely dramatic. It doesn't happen with loud symptoms. It happens quietly, in small changes that blend into everyday life. As we age, our arteries naturally become stiffer, and our blood moves with less ease. That means the heart has to work harder to deliver oxygen, even when you feel perfectly calm on the outside. From my years of experience, I've seen how recognizing these subtle signs gives seniors an incredible advantage. Awareness creates confidence. Understanding what your body is telling you allows you to protect your heart long before disaster has a chance to unfold. In the next part, we'll explore exactly how poor circulation affects your heart, the symptoms most seniors overlook, and the everyday habits that quietly increase heart attack risk. And if you find these insights helpful, I warmly invite you to subscribe to Senior Health Daily so we can continue this journey together. How poor circulation starts in older adults. When we begin talking about poor circulation in older adults, many people imagine it as something dramatic or immediately painful, but most of the time it starts quietly. It begins in the smallest moments, the ones that feel harmless at first. A little pressure in the legs, a few extra steps that suddenly feel heavier, a foot that cools down faster than it used to. These are not random changes. They are early signs of shifting blood flow, and they show up long before anything truly frightening happens. As we age, our blood vessels naturally become less flexible. When you were younger, your arteries expanded and contracted effortlessly. They were soft, responsive, open. But with time, they stiffen just a little. The inner lining becomes less smooth, and the blood doesn't move with the same ease it once did. You might not feel these changes directly, but your body notices. Your heart notices. It has to push a little harder to move blood through vessels that no longer open as wide as they used to. Muscles also change with age. They don't absorb oxygen as quickly or as efficiently. That means the heart must not only pump harder, but also pump more often to meet the same demand. If you've ever wondered why a short walk leaves you slightly winded now, even though it never used to, part of that answer lies in how your muscles and circulation have slowly changed over time. These shifts are normal, but they make the heart more vulnerable when circulation begins to weaken. I've seen these early stages hundreds of times in my patients. A gentleman in his early 70s once told me he felt a strange heaviness in his calves every time he climbed the stairs. He thought it was just age catching up, but it wasn't age alone. His blood flow was slowing, and his body was trying to warn him gently before it needed to warn him loudly. That gentle stage is where intervention matters most. Slow or uneven blood flow creates hidden stress inside your cardiovascular system long before pain appears. The heart works harder behind the scenes, pushing against resistance you don't see. Many seniors notice this only through subtle changes, feeling more tired after meals, needing to catch their breath sooner, or feeling lightheaded when getting up too quickly. These moments seem small on their own, but together they whisper the story of a heart carrying a larger workload than you may realize. Poor circulation often begins in the legs because they are farthest from the heart. Gravity makes blood return slower, so the legs often reveal circulation problems first. When blood moves too slowly, oxygen delivery decreases. Muscles fatigue faster. The skin cools. Even wounds take longer to heal because the nutrients that support healing arrive late. You may not associate a slow healing cut or cold toes with your heart, but everything in the body is connected. When circulation slows in the legs, it's a sign the cardiovascular system is under strain. The emotional part of this is just as important as the physical. Many older adults blame themselves for these changes. They think they're getting weak or losing capacity. But poor circulation isn't a personal failure. It's a physiological shift that happens quietly and gradually, and most seniors are never told what the earliest signs look like. Once you understand these changes, you can recognize the signals your body has been sending, maybe for years. What's powerful is that these early shifts reveal so much about your heart's health, long before a heart attack is even close. Poor circulation doesn't mean an attack is coming immediately, but it does mean your heart is working harder, and harder work over time creates vulnerability. In the next part, we'll explore why poor circulation can become a trigger for heart attacks, how it deprives your heart muscle of oxygen, and why even seniors with perfect cholesterol can still face hidden artery blockages. And as always, if you're finding value in this conversation, I'd love for you to subscribe to Senior Health Daily so you can stay connected to life-changing guidance every week. Why poor circulation becomes a heart attack trigger. When poor circulation begins to settle into the body, the heart is the very first organ that feels the burden. Many people imagine heart attacks as sudden, dramatic events that appear out of nowhere. But in reality, a heart attack often begins with a long period of quiet struggle, where the heart has been working harder and harder, often without you noticing. Poor circulation is one of the earliest steps in that hidden struggle. Think of your blood vessels as highways. When they are wide and open, blood moves smoothly and quickly. But when circulation weakens, those highways narrow. They become rough, stiff, and less responsive. Your heart must push blood through narrower passages, and this increased resistance creates stress that builds slowly over time. The heart is a strong muscle, but even strong muscles strain when forced to work harder every day. Poor circulation also reduces the amount of oxygen reaching the heart muscle itself. Many people don't realize this. They assume circulation only affects their legs or feet, but low blood flow affects the entire body, especially the heart. When oxygen delivery drops, the heart becomes more vulnerable. It tires more easily. It becomes more sensitive to stress, temperature changes, emotional strain, and even certain foods. Over time, this lack of oxygen creates an environment where heart damage can develop quietly. What makes this especially complicated is that poor circulation contributes to plaque buildup. When blood isn't flowing smoothly, it becomes easier for cholesterol, calcium, and inflammatory molecules to settle along artery walls. These deposits grow slowly, layer by layer, like dust collecting on a shelf. You might not feel anything as it builds, but eventually it narrows the arteries even further. This narrowing can suddenly block blood flow during stress, physical exertion, or even a heavy meal, triggering a heart attack. One of the most eye-opening observations from my clinical experience is that plaque buildup does not only affect seniors with high cholesterol. I've seen people with perfectly normal cholesterol levels develop significant artery blockages simply because their circulation remained poor for too long. Their arteries were stiff, blood flow slow, and inflammation constant. This environment created the perfect conditions for plaque to form, even without classic cholesterol problems. There was a patient in his late 60s who always prided himself on having excellent cholesterol numbers. He exercised occasionally, maintained a reasonable diet, and thought he was in great shape. But he often complained about cold feet and heavy legs. He brushed it off as poor weather or aging. When he suddenly experienced chest tightness one afternoon, we ran tests and discovered early blockages in his coronary arteries. He was shocked. He had always believed good cholesterol meant a healthy heart, but his circulation had been struggling for years without him realizing it. Poor circulation also affects blood pressure in unpredictable ways. When arteries stiffen and narrow, the heart must push harder. which can cause sudden spikes in blood pressure. These spikes can be dangerous, especially when combined with stress, dehydration, or a large meal. Many people describe these moments as pressure in the head, a sudden warm flush, or a feeling that their heart is thumping harder than usual. These aren't random moments. They are the heart's way of signaling that circulation is not keeping up with its needs. Another hidden danger is how poor circulation affects heart rhythm. The heart depends on a precise electrical system to beat in the right pattern. When blood flow becomes unstable or slow, it disrupts this electrical balance. Some seniors feel this as a flutter, a sudden thump, or a skipped beat. Others feel their heart racing, even when they're sitting quietly. These sensations often appear before any major event and are one of the earliest heart attack warning signs. All of this happens quietly, often without pain, which is why so many older adults ignore the symptoms. They assume the changes are normal. They think it's age, stress, or fatigue. But what's really happening is that the heart is communicating. It is telling you that it's working harder than it should and needs support before the situation becomes dangerous. Understanding this connection gives you something incredibly valuable: the ability to act before damage becomes severe. You don't have to wait for a crisis. You don't have to wait for pain. Recognizing these early changes can protect you long before a heart attack ever develops. In the next part, we'll talk about the early poor circulation symptoms most seniors overlook and how these small signals can reveal big truths about your heart's health. If what you're learning speaks to you, I invite you to subscribe to Senior Health Daily so we can continue supporting you on this important journey. Early poor circulation symptoms. Seniors ignore. When poor circulation begins affecting the body, it usually doesn't announce itself with sharp pain or dramatic symptoms. Instead, it slips into your daily life in ways that feel small, ordinary, and easy to dismiss. That's why so many seniors overlook the early warning signs. They don't look like emergencies. They look like everyday inconveniences, tiny frustrations, or normal effects of aging. But inside, your heart is trying to tell you something. One of the earliest signs is cold feet or cold hands. People often laugh about it or joke that they just run cold. But when your extremities cool down for no clear reason, it's usually a sign that blood isn't reaching the smaller vessels at the edges of your body. That doesn't mean your heart is failing, but it does mean circulation is struggling. Your heart is working harder to push warm, oxygen-rich blood to places it used to reach easily. Another common symptom is tingling, numbness, or a burning sensation in the hands or feet. I've had patients describe it as pins and needles that come and go without warning. Many assumed it was nerve-related, and sometimes it is, but very often it's poor circulation. When blood flow drops, nerves don't receive enough oxygen and begin sending distress signals. It's your body's way of alerting you long before serious damage occurs. Leg pain or heaviness when walking is something I hear about almost daily. Seniors blame their joints, their shoes, or simply their age. But circulation plays a major role here. When your muscles aren't receiving enough oxygen, even simple activities like climbing stairs or walking to the mailbox can feel harder than they should. It's not weakness, it's not laziness. It's a sign that your blood flow is slowing down and your heart is pushing harder behind the scenes. Swollen ankles are another overlooked sign. Many assume swelling is caused by salt, heat, or standing too long. While those can contribute, poor circulation often plays a much bigger role. When blood isn't moving efficiently, fluid begins to pool. Sometimes the swelling appears only at night, sometimes only on one side, sometimes it comes and goes. But each time, it reveals a struggle inside the circulatory system. Slow healing wounds are also important to notice. Cuts that stay red for too long, bruises that take forever to fade, or small injuries that don't seem to improve the way they used to can all indicate reduced blood flow. Healing requires oxygen, nutrients, and strong circulation. When blood moves slowly, the body simply doesn't repair as quickly. Some seniors assume their skin is fragile because of age. In reality, their circulation might be asking for help. Another sign many seniors brush aside is cramping in the calves at night. People think it's dehydration, and sometimes it is, but circulation plays a major role. When blood flow drops while you're resting, your muscles begin to tighten and spasm. These cramps can feel sharp and sudden, and they often strike without warning. They are not random. They are signals of overworked muscles that aren't receiving the nourishment they need. Fatigue and dizziness after mild activity are two of the most misunderstood symptoms. Seniors often blame these feelings on sleep issues, stress, or simply having a slow day. But when blood flow is compromised, the brain and muscles don't receive enough oxygen quickly enough. Something as simple as standing up or taking a short walk can trigger lightheadedness. This isn't just inconvenience. It's the heart telling you it's under strain. The biggest problem is that all these symptoms can easily be mislabeled as just aging. And I understand why. None of them scream danger. They whisper. And because they whisper, people ignore them. But what I want you to understand is that your body rarely sends signals without a reason. Each of these small changes is a clue. Together, they create a picture of how hard your heart is working. Recognizing these early symptoms doesn't mean you need to panic. It means you have the chance to act early, make gentle changes, and support your body before something more serious happens. In the next part, we'll look at the silent signs that hint a heart attack may be developing long before you ever feel real chest pain. These signs often hide in the shoulders, jaw, breathing patterns, or even your energy levels. And understanding them can change your future. If you're finding these insights meaningful, I'd love for you to subscribe to Senior Health Daily so you don't miss the next life-saving chapter. Silent signs that point to a coming heart attack. When we talk about heart attacks, most people imagine the dramatic kind you see in movies. A person collapsing, clutching their chest with a look of panic. But in real life, especially for seniors, heart attacks rarely start that way. Most of the early signs are quiet, subtle, and easy to explain away. They blend into everyday life. They appear during meals, during rest, or during moments when you'd never expect something serious to be happening inside your body. One of the silent signs that often goes unnoticed is a subtle chest tightness after meals. Not sharp pain, not a crushing sensation, just a little pressure that seems to sit in the center of the chest for a few seconds. Many seniors mistake this for indigestion, heartburn, or stress. But what's really happening is that the heart is asking for more oxygen than circulation can provide. When blood flow is compromised, even digesting a meal can become a challenge for the heart. Another sign is pressure that moves into the jaw, shoulders, or upper back. This refers to the way the heart sometimes sends signals through shared nerve pathways. The discomfort doesn't always feel like heart pain. It can feel like a sore muscle, a stiff shoulder, or even a dental ache. I have had patients who believed for months they were dealing with arthritis in their shoulder, or a simple jaw issue, only to learn later that it was circulation-related discomfort pointing directly to the heart. Shortness of breath when lying down is another quiet indicator many seniors ignore. They sit up suddenly at night, feeling as if they can breathe better at an angle than flat on their back. They think it's allergies or age, but often, this is a sign that circulation is not keeping up with the heart's needs. When lying down redistributes blood flow, the heart must work harder. If circulation is compromised, breathing becomes strained and uncomfortable. Sudden tiredness with no clear reason is another subtle sign, not the kind of sleepiness that comes from a long day, but the kind that washes over you unexpectedly. You might be walking through your home, folding laundry, preparing a meal, or simply talking, and suddenly your body feels heavy and drained. This type of fatigue is your heart's way of saying it's not receiving enough oxygen-rich blood to sustain normal activity. And then there is the heart pounding after mild exertion. You climb a few steps, bend down to pick something up, or walk across a parking lot, and your heart suddenly feels more forceful than it should. It might not hurt. It might not even be irregular. It simply feels stronger, louder, or more noticeable. This is not just a heartbeat. It is a sign of a heart working harder than necessary. Poor circulation makes even simple tasks feel like challenges. These quiet signs are powerful because they appear before chest pain ever does. They are your body's early alert system. They are your heart saying, "Something isn't right. I'm struggling more than you think." And yet, they are the signs seniors most often ignore because they are easy to dismiss. Everyone gets tired. Everyone gets a sore shoulder. Everyone has moments where their chest feels a little tight. But these symptoms, especially when they come and go, are not random. They are patterns your body wants you to notice. One patient of mine, a woman in her early 70s, told me she often had a strange pressure in her upper back after dinner. She thought it was her posture or a muscle strain. She didn't feel anything dramatic, so she dismissed it. When she eventually came in for a checkup, we learned her coronary arteries were struggling to deliver enough oxygen. Her back pressure wasn't a muscle issue. It was her heart sending distress signals through quieter pathways. That's why understanding silent symptoms is so important. You don't have to feel pain for something serious to be developing. In fact, many seniors never feel classic chest pain before a heart attack. Their symptoms appear in places they don't associate with the heart: shoulders, jaw, upper back, breathing. Energy levels. These are the places where the heart often speaks first. Recognizing these quiet signals can save your life. They allow you to act early, seek help early, and make changes before a crisis occurs. In the next part, we'll talk about how poor circulation and irregular heart rhythms are connected, and why so many seniors experience flutters, thumps, or skipped beats long before they realize their heart needs attention. And if these insights are helping you understand your body better, I warmly invite you to subscribe to Senior Health Daily so we can continue this journey together. How poor circulation and heart rhythm are connected. Everyday habits that worsen poor circulation. When circulation slows down or becomes unstable, it doesn't just affect your muscles or your energy levels. It affects the very rhythm of your heart. Your heart relies on a finely tuned electrical system to keep each beat steady and coordinated. But that system is sensitive. It reacts quickly to changes in oxygen levels, blood flow, and pressure inside the arteries. When circulation begins to falter, the heart's electrical signals can become disrupted, leading to irregular beats that many seniors feel long before they recognize them as warnings. Many older adults describe these sensations in different ways. Some say it feels like a flutter, almost like a bird moving inside the chest. Others describe it as a sudden thump, a beat that lands harder than expected. Some talk about skipped beats that catch them off guard during quiet moments. These sensations can come after meals, during stress, while resting, or even at night. They are not always painful, but they are important. They tell us the heart is struggling to maintain its rhythm because it isn't receiving the steady flow of oxygen-rich blood it needs. I recall a woman in her early 70s who would wake up each night feeling her heart fluttering. She believed it was anxiety or bad dreams. But when we monitored her heart, we discovered she was experiencing arrhythmias triggered by low circulation. Each time her blood flow dipped, her heart's electrical signals lost their stability. Once we improved her circulation through simple lifestyle changes, her episodes became significantly less frequent. Another man I treated often felt a sharp thump in his chest when he stood up too quickly or walked up a short incline. He joked that his heart was trying to get his attention. In a way, he was right. His circulation wasn't keeping up, and his heart was responding by working harder, faster, and with more force. These moments aren't random. They are messages, small ones, but meaningful. Now, while some of these rhythm issues require a medical evaluation, many of them worsen because of habits older adults don't realize are affecting their circulation every single day. And the truth is, most of these habits are incredibly common. You might even recognize some in your own routine. One of the most harmful habits is sitting too long without movement. When you sit for hours, blood settles in the legs, muscles become inactive, and circulation naturally slows. Many seniors spend long periods watching TV, reading, or doing crossword puzzles without realizing their heart is receiving less support than it needs. Another habit is drinking too little water. Hydration plays a major role in circulation. When the body is even mildly dehydrated, blood becomes thicker and harder to move. This creates more work for the heart and can lead to swelling, dizziness, and those sudden pounding heartbeats many seniors describe. Skipping meals is something else I see often. Many people think eating less helps maintain weight or control blood sugar, but for seniors, skipping meals can cause blood pressure drops and unpredictable circulation patterns. When you finally eat, the sudden rush of glucose and digestion forces the heart to compensate, sometimes causing flutters or fatigue. Eating too much salt or sugar also worsens circulation. Salt causes fluid retention, making the heart pump harder. Sugar, as we discussed earlier, triggers inflammation and oxidative stress that stiffen the arteries. Together, salt and sugar create a powerful strain on the cardiovascular system. Wearing tight socks or clothes sounds harmless, but it can restrict blood flow in the legs. When circulation is already compromised, even a little extra pressure can worsen swelling, numbness, and heaviness. Lack of leg muscle activity is surprisingly significant. The legs contain strong muscles that act as pumps to help push blood back up to the heart. Without regular movement, this system weakens, worsening circulation over time. And then there's emotional stress. Stress causes hormones to rise, blood vessels to constrict, and the heart to beat faster. When combined with poor circulation, stress becomes a heavy burden on the heart. I've watched many seniors improve dramatically just by adjusting one or two of these habits. A little more water, a short walk after meals, stretching the ankles and calves a few times a day, reducing salt, giving the legs a break from tight socks. These changes seem small, but they make a noticeable difference. The heart responds quickly when it receives better support. Understanding the link between daily habits and poor circulation empowers you to make choices that protect your heart rhythm and your overall cardiovascular health. In the next part, we'll explore how to improve circulation naturally, the simple daily steps that can transform your energy, and the powerful ways these habits protect against heart attack risk. And if this message resonates with you, I invite you to subscribe to Senior Health Daily so you never miss the guidance that keeps you safe and informed. How to improve circulation naturally. Now that you understand how poor circulation begins and why it can place such a quiet strain on your heart, I want to shift towards something hopeful and empowering. The truth is that improving circulation doesn't require dramatic changes. You don't need expensive equipment or complicated routines. Your body responds beautifully to gentle, consistent care, and many seniors begin to feel the difference within weeks. Some even feel lighter and more energized within days. The heart may work tirelessly, but it also heals when we give it the right environment. One of the most powerful ways to improve circulation is to walk for just 10 minutes after meals. I know it sounds simple, almost too simple, but I've watched patients transform their daily energy with this one habit. When you walk after eating, your muscles immediately pull glucose from the bloodstream, easing pressure on the heart and smoothing out blood flow. You don't need to walk fast or far. A short, gentle stroll is enough. Your body loves movement more than you realize. Drinking water before you feel thirsty is another small habit that makes a big difference. Dehydration thickens the blood, making it harder for your heart to pump. Many seniors don't recognize when they're dehydrated because the sensation of thirst fades with age. I've had patients who barely drank water and were shocked at how much better they felt after increasing their intake slowly over time. Hydration supports circulation, reduces dizziness, and helps maintain a steady heart rhythm. Stretching the legs and ankles daily is another overlooked tool. Your leg muscles act like pumps that help push blood upward toward the heart. Simple movements like lifting your heels, circling your ankles, or stretching your calves for a few seconds at a time improve blood flow significantly. These movements are gentle enough for anyone, and they're incredibly effective. Avoiding long periods of sitting is equally important. When you sit for too long, especially in the same position, blood settles in your legs. You might notice swelling, stiffness, or a heavy feeling because circulation has slowed. Getting up every 30 to 45 minutes for even a few steps can help keep your blood moving. Many of my patients set a soft reminder on their phone or simply use commercials during TV time as a cue to stand and move for a moment. Elevating your feet for a few minutes each day helps circulation return from the legs to the heart. It doesn't have to be dramatic. Just resting your feet on a small pillow or on the edge of the couch while you relax can ease swelling and promote a more stable flow of blood. Eating more leafy greens and berries supports circulation too. These foods are rich in antioxidants that protect the artery walls and reduce inflammation. You don't need exotic ingredients or complicated recipes. A handful of spinach in your omelet or some berries with your breakfast can make a noticeable difference over time. Limiting sugar and sodium also reduces stress on your arteries, helping your heart work with more ease. Warm compresses on cold feet are another simple technique that many seniors find comforting. Warmth opens blood vessels, improves circulation, and soothes discomfort. It also signals the nervous system to relax, which benefits the heart. Maintaining steady blood pressure is crucial. Sudden spikes place massive strain on circulation and the heart muscle. By improving your daily habits, staying hydrated, moving gently, and managing stress, you give your body what it needs to keep pressure more stable throughout the day. What I want you to know is that these habits don't need to be perfect or practiced all at once. You don't have to change your entire life overnight. You don't have to force yourself into routines that feel overwhelming. Small, steady steps create powerful results. Every time you choose to walk a few minutes after a meal or take a sip of water before you feel thirsty, you are helping your heart breathe easier. You are reducing inflammation, supporting your arteries, and giving your body the nourishment it needs to heal. I've seen seniors who thought they would feel tired forever suddenly discover new energy. I've seen swelling disappear, cold feet warm up, leg cramps fade, and heart rhythms stabilize. Healing is real, and it's possible, even after 60 or 70 or more. In the next part, we'll explore some of the most dangerous myths seniors believe about circulation and heart health, and why so many misconceptions keep people from recognizing early warning signs. And if this guidance is helping you understand your body better, I gently encourage you to subscribe to Senior Health Daily so you never miss insights that could support your life and well-being. The most dangerous myths seniors believe. When it comes to poor circulation and heart attack warning signs, one of the biggest challenges is not just the symptoms themselves, but the myths that keep seniors from taking those symptoms seriously. These myths are powerful because they feel comforting. They make people believe nothing serious is happening. But these beliefs can delay life-saving action and blind individuals to the quiet signals their heart has been sending for months or even years. One of the most common myths I hear is, cold feet are normal at my age. I understand why people say this. Aging changes the body in so many ways that it's easy to assume every new sensation is simply part of getting older. But cold feet aren't just age. They are circulation talking to you. When blood flow becomes inconsistent, the smaller vessels in your feet and toes are the first to struggle. That is not a harmless change. It's a message. Another myth is, I'm tired because I'm old. Yes, fatigue can come with age, but sudden or unexplained tiredness is not something to ignore. When your heart isn't receiving the oxygen it needs, exhaustion will show up even in the simplest tasks. I've had seniors tell me they used to clean the house, run errands, or garden for hours, and now they can barely finish a load of laundry without resting. That shift is not about age alone. It's about how hard your heart is working. The myth that worries me the most is this one. If it doesn't hurt, it's not serious. Pain is not the only signal of danger. In older adults, especially, pain may never appear at all. Heart attacks often start quietly. The early signs hide in subtle changes in breathing, posture, energy, or sensation. Many seniors never feel the classic chest pain that younger adults might experience. Instead, they feel discomfort in the jaw, shoulders, upper back, or even their stomach. The heart speaks softly at first. If you wait for pain, you may wait too long. And finally, there's the myth that my heart is fine because my cholesterol is fine. I cannot tell you how many seniors have been misled by this belief. Cholesterol is important, yes, but it is only one part of the picture. Circulation, inflammation, blood pressure spikes, glucose levels, stress, and artery stiffness all play enormous roles in heart health. I've had patients with perfect cholesterol who still developed serious artery blockages because their circulation had been poor for too long. A healthy heart requires more than one good number. These myths create blind spots. They make people dismiss symptoms that deserve attention. They prevent early intervention and allow preventable problems to grow silently. But here is the hopeful truth. Once you see through these myths, you gain the power to protect your heart with clarity and confidence. And this is where empowerment begins. Your heart is incredibly resilient. It has carried you through decades of life, through stress, joy, grief, celebrations, illness, and healing. It has never stopped working for you. Even now, even if you feel tired or worried, even if your circulation has been struggling, your heart still wants to heal. It still wants to support you. It responds to every act of care you give it, no matter how small. Seniors often tell me they feel discouraged, as if making changes won't matter at their age. But I've seen remarkable turnarounds in people well into their 80s. I've seen cold feet warm up again, swelling lessen, breathing improve, and energy return. I've witnessed seniors who couldn't walk across their kitchen regain the ability to walk around their neighborhood simply by adding daily movement and consistent hydration. Your efforts matter. Your habits matter. Your body is still listening to you. You deserve to move through your days with steadiness, comfort, and peace. You deserve mornings that greet you with energy and evenings that close with ease. And you deserve to feel confident in your heart's strength, not worried or uncertain. In the next part, we'll gather all these lessons into a clear emotional message that lifts you up and encourages you to take care of your heart with gratitude and purpose. And if you've found these insights valuable, I warmly invite you to subscribe to Senior Health Daily. Your support helps us reach more people who need these life-changing messages, and it allows us to continue walking alongside you on this journey toward a stronger, healthier future. As we reach this final segment of our deeper conversation, I want to shift the focus away from fear and towards something far more powerful: hope. You've learned a great deal about poor circulation and how it quietly affects the heart long before a heart attack ever occurs. But knowledge alone isn't the destination. The true purpose of understanding your body is to help you feel empowered, capable, and supported as you protect your heart for the years ahead. I want you to take a moment and think about everything your heart has done for you. Through every memory, every joy, every loss, every milestone, this remarkable organ has been there, working faithfully without asking for thanks. It has carried you through illnesses, supported you through sleepless nights, calmed itself during emotional storms, and given you strength during moments when life felt heavier than usual. Your heart has never taken a day off, not once, and even now, no matter your age, it still wants to keep you here, healthy and strong. That's why recognizing the early signs of poor circulation matters so much. It's not about expecting the worst. It's about giving your heart the support it deserves before stress turns into danger. Once you understand what your body is trying to tell you, you gain something incredibly powerful: choice. You gain the choice to act early, the choice to make gentle changes, the choice to protect yourself with knowledge, clarity, and intention. I've seen seniors make remarkable improvements simply by believing they still have control. A woman in her late 70s once told me she had given up on feeling energetic again. She believed her tiredness was permanent, but when she began taking 10-minute walks after meals, drinking more water, and stretching her legs each day, she told me she felt as if someone had turned the lights back on inside her body. The improvement wasn't dramatic overnight. It came from consistent, loving attention to her own needs. Another patient who struggled with swelling and cold feet found relief after elevating his legs daily, reducing salt intake, and walking in short intervals throughout the day. He said the changes felt so simple that he doubted they would work. And yet they did. His energy improved, his legs felt lighter, and his heart rhythm became more stable. His transformation wasn't about age, it was about learning to listen to what his body had been quietly whispering for years. That's the message I want you to carry with you. It is never too late to support your heart. Never too late to strengthen your circulation. Never too late to feel better than you do today. Your body responds to kindness. Your heart responds to attention. And even small acts of care can create big shifts in how you move, breathe, sleep, and live. And as you continue learning, I want you to know that you're not walking this journey alone. That's why Senior Health Daily exists. This channel is here to guide you with compassion, clarity, and the kind of real-world understanding that comes from decades of caring for older adults. If what you've learned so far has opened your eyes or eased your worries, I gently invite you to subscribe to Senior Health Daily. It helps our community grow and allows us to keep bringing life-changing guidance to seniors across the country. And if you've found something meaningful in this video, something that made you pause and think, I'd be grateful if you'd tap the like button. It lets us know these messages are helping you. And if someone you love has been experiencing the subtle signs of poor circulation, consider sharing this video with them. You never know whose life could change from a message like this. Your heart deserves your care, your body deserves your patience, and you deserve the confidence that comes from understanding what's happening inside of you. In the next part, we'll bring all of this together in a heartfelt message about gratitude, resilience, and the quiet strength within your body. It's a moment of reflection and empowerment that I can't wait to share with you. As we close this conversation together, I want to leave you with a gentle reminder. Poor circulation is quiet. It rarely shouts for attention. But once you learn what these early signs look like and understand how they affect your heart, you gain something incredibly powerful. You gain the awareness that can prevent a crisis. You gain the ability to act before danger grows. Knowledge truly becomes your strength. I hope you take a moment to appreciate what your heart has done for you. For decades, it has carried you through joy, stress, change, loss, growth, and every season of your life. It has never asked for rest. It has never stopped showing up for you. And now that you understand these subtle signals, you have the chance to show up for your heart with the same loyalty. It deserves your kindness, your patience, and your gentle attention. Healing never starts with perfection. It starts with awareness. It starts with one small step, then another. A short walk after meals, a glass of water before you feel thirsty, a willingness to notice what your body has been trying to tell you. These simple acts create powerful protection, and you deserve that protection. You deserve years filled with presence, energy, and meaningful moments with the people you love. You are stronger than you think. You are more capable than you realize. And your heart is absolutely worth every step you take to care for it. If today's message touched you, I warmly invite you to subscribe to Senior Health Daily so we can continue this journey together. Thank you for spending this time with me. I wish you health, clarity, comfort, and a peaceful heart in all the days ahead.